Alrighty, so as you might have seen in the other session, my name is Doug, Test Prep Specialist, and I'll be presenting in the next session if you want to learn a little bit more about what you can do on the MCAT. In the meantime, we're here to talk a little bit about financing your med school education, and here to talk to us about that is Ronnie Rivas. He's with the U.S. Army, and I'm going to turn it over to him.
Hey, so good morning, and thank you for joining me today on this lovely Saturday. Working from home still and on the computer, great. So yes, today I'll be speaking to you a little bit about financing your medical education, and just a little bit about myself. My name is Staff Sergeant Ronnie Rivas. I've been in the Army 17 years, almost 18 years now. My trade in the Army is a medic. As a medic, I got specialized training in optometry and ophthalmology. So I got to assist the doctors with surgeries and cool stuff like that. And then I was also a flight medic, as you can see in that picture there, for a few years, dealt with a lot of traumas, and did a lot of good humanitarian missions as well. Been all over the world, been to Germany, all over the European nation, I can say, as well as the United States. Traveled and got to see many things. Joining the Army is one of the things that I wanted to do, is travel, and I've definitely gotten to do that. So this is a picture of my family here. It's quite a few years ago, but I just kind of want to throw in there to show you that yes, you can have a family in the military, in the Army, and still be functional and still have a good career and be happy. Me and my wife been together 23 years now, and we've been doing great together. So enjoying life. So the Army does, we are helping out during these COVID times. We're helping out with the overwhelmed hospitals. We're setting up our own tent areas and stuff like this to kind of assist, with whatever's needed to kind of offset the shorthandedness that we're having in these times. So definitely, we need your help, as in times to come, especially. So the Healthcare Professional Scholarship Program. That's like the best program I think we have in the Army. We do have a lot of them, but this is the one that my 17-year-old son, I'm kind of pushing for him. Hey, when you graduate, this is something that you need to do, because I believe in this program so much. And this is actually a picture of one of our recent recipients of the scholarship. His name is Jason. He was enlisted before. He got out of the Army and took advantage of going to college. The Army has a program where they give you money to, to go to college full time. And while you're going to college, they give you a stipend as well. They give you like housing allowance, so that it eases the cost of, eases the burden of going to college. So he took advantage of that undergrad and UC Davis, and he actually graduated, pretty near the top of his class. And he says, "Hey, I want to come back. My dream is always be a surgeon for the United States Army." So right now he's going through medical school, and it's looking up for him. So we're crossing our fingers that he's going to be we know that he's going to be a great guy in the future. So, and he's going to be taking care of our soldiers. So what does this scholarship pay for? So we give 100% tuition for dental, medical, and then for veterinary school as well. The veterinary school, we do give a 3-year scholarship. We don't give that 4-year scholarship, but it's still a very good program. You also receive a bonus, $20,000 bonus, which is a pretty good bonus. Start off to starting school. Finding that dorm room, paying for all your initial costs of moving. Stuff like that. This $20,000 is minus tax, but you also get that stipend. It always goes up every year according to whatever the fluctuation of the cost of living is. And this year it's right under $2,500 a month for 10.5 months out of the year. Of course, we do not pay for summertime at that rate. We actually have you go through a training, which you make a little bit more money. So it's a 45-day training. And you make right under $8,000 during that training. So there's a lot of good ways to make money, without having to sacrifice your time for medical schooling. That's one of the things that the Army knows that is so hard, is in anything you do, is time. Time. Don't take away my time. I need it for this. I need it for that. So the Army realizes that and says, okay, we're going to leave you alone during your schooling, with the exception of this active duty training during your summer vacation. We do also reimburse for books and any other fees that are associated with your classroom. So if you have microscope fees, if you have book fees, if you have any fees that are associated with the class that the classroom says, hey, you need this, then the Army will reimburse you for those fees. So estimated pays and allowances during school. So we kind of broke it down, into the 10 and a half months that you get that stipend, the 45 days of training that we told you you need to do. Your housing allowance depends, I think it went up again this year, so I didn't update that yet. And then your basic allowance for subsistence, which is food. When you're active duty, for those 45 days, the Army does pay you for food. So when you gather up all those pays and allowances, it's right under $34,000. So, and that doesn't even include that $20,000 bonus that we're giving you as well. So it's a pretty good start, to easing your burdens of going to college, medical school. So what are some of these qualifications? So you must be a U.S. citizen. You have to have at least a 3.2 GPA, which 3.2 is going to get you through the door. But to be competitive, we want to see, at least 3.4, 3.6. But that still doesn't guarantee anything. The Army is always looking for that person, a round person that has many attributes. As an Army officer, you're going to be leading soldiers. So the Army wants to see that you have potential, or that you've been in leadership positions to where you can step up and take hold of situations. We're not a group that stays in the corner and stays quiet. We're a group that's out in the front, doing things, always trying to pass those lines and stuff. So we want to see that outgoing person as a whole. Your MCAT scores, 500 with a 124 in each category. If it's a little lower, we do have some waivers sometimes that we can do, but they're pretty stringent on those scores. So your dad is 19, and you must be physically or morally qualified. So what does that mean? We do have a height and weight standard, and if you have any major happenings with law enforcement, then we must know as well, because we do an extensive background check on you. I believe it's a 10-year background check. You'll be receiving a secret clearance at the end of this, so it's pretty cool stuff as well. So when do you start talking to us? So, I mean, we'd like to talk to you at any time, really. I've been talking to a lot of second-year students lately, but third and fourth years, when you start kind of gearing down to like, all right, this is what I want to do. This is how I want to do it. But definitely, if you're in the earlier years, let us know, because we can always give you those guidelines as to where do you need to, what do you need to be doing? Do I need to be out and about getting a job? Do I need to be, volunteering my time? It's good to know all these things in advance, so that you can definitely prepare yourself. And then you don't have to, a lot of people, they think that you have to wait till you get that acceptance letter, and that's not true. Waiting for your acceptance letter sometimes is going to put you behind the power curve. We can accept you, right at that fourth year, and you start applying. The only thing we need from you is a list of schools that you're applying to. And then when we say, hey, you did receive the scholarship, but it's going to be pending a letter of acceptance. So, don't wait to get that letter of acceptance, because that's just going to hinder you. We start giving out scholarships in October. And we give them out the whole year until they're all completed. So we did give away, we are giving away 290 this year for medical. For dental, I think it's 75. And for veterinarian, it's 33. So, they're pretty good chances, but with these COVID times, a lot of people are having more difficulties. So we are having a lot more people apply through our programs. So definitely get in early, because it's a lot easier. As these scholarships dwindle, every month, it gets a lot harder to get into these programs. So what will you need when applying? So this is kind of a basic list of what we need. There might be a couple things here and there as well. We do have a program, like I said, to assist you with getting a secret clearance. Again, that one goes back 10 years. So they're going to look at, who you know. They might even call those people, where you lived and stuff like that. So medical history. You know, if you have any broken bones, if you have any asthma, if you have depression, stuff like that, these are things that we need to know as well. Because again, when they look at that history, they're going to find all these things. So we need to know in advance so we can kind of prepare you as to what we need to do for that situation. Letters of recommendation. So we ask that you get 3 to 5 letters of recommendation, and those are going to be from either professors or they can even be from supervisors. We recommend that, somehow or another that you find out, or you get with us to find out a person that may be in the military already as an officer, and preferably in the medical field. Having those letters of recommendation are very going to be very good for you. The Army wants to see that somebody in the military doing that job thinks that you have what it takes to do that job. So that's going to help out a lot. If you don't know anybody or anything, it's not, not to discourage you and say, hey, you don't have any chances. Definitely, again, talk with us and we can see if we can line you up with people that, in that direction, or send you in another direction, because even political leaders and stuff like this that you may know are definitely going to be a good recommendation for you. Letter of intent. So yes, that's very brief and simple. It's a 1-page letter. It kind of says your short-term goals, your long-term goals, what leadership skills did you do, that you hold, what leadership skills do you have potential for. So it's a brief letter about yourself, basically. And again, we can help you with some examples on that as well. So how long do you have to serve? So yes, so it is a 4-year program for the scholarship. You do have your residency at the end of that. And it is actually whichever is greater. So if you have like a 3-year residency and you do those 4 years, then you would actually owe 4 years back. But if you did like a surgical residency that's 6 years, then you'd owe 6 years back. But just know that any military obligation that you do commit to, it's always an 8-year obligation. And I know that's kind of a little bit like, okay, you just said 6 years. But what happens is you have that 8 years, and say you do that 6-year residency, so you owe 6 years back. Well, you still have that remainder 2 years. So you can do 3 things to pay back for this remainder 2 years. You can either stay in the active service because you found out you do like it and you want to continue with it. You can go active reserves, which is 2 days a month, 14 days a year. You still make a small paycheck. You're still able to get some of the programs that we have and stuff. And then you finish off your time that way. Or you can say, no, I'm really done with this. The last 2 years, I just want to be put on the list and left alone to live my life. And if for some reason the Army says, hey, we have a draft and we need you back, because we're shorthanded in your specialty or whatever it might be, then we have that authority to kind of pull you back. But again, it is a draft. And when's the last time we had a draft? So those are the 3 different things you can kind of do to kind of continue those last few years. But just know too, at the end of that, you are debt free. I've talked to a lot of different doctors and people, and one of the doctors I talked to, after 17 years, he tells me he still owes over $100,000 in debt. So having this program and even doing that 6-year program, 6 years of payback, that's still gonna way outweigh the 17 years. Another thing too is, for me, being in the Army, 17, 18 years in the medical field, seeing everything I've seen, you know, and working with all the doctors and stuff that I've worked with, I can definitely say that, you know, there's a big difference between being in a city working with the city population, as opposed to being in an army hospital working with the army population. In a city, and I say this about San Antonio because I'm from San Antonio, Texas. You know, we have, if you get a medical call, more than likely it's going to be, they call it the trifecta. You have high blood pressure, high cholesterol, and diabetes, right? So that's you know, that's a ethnicity, that's a predominant population. You know, that's what they have. Their eating is not so well. You know, it's delicious, but it's not so well for your body. So those are the ailments that population has. So if you were to be a doctor there, you know, that's what you're going to see over and over and over. As opposed to being on a military facility in the Army hospital, where we have, you know, people from every place. You know, I have the soldier next to me is from Guam. You know, somebody else is from, you know, from Washington. You know, everybody's from different places, and they all come with their different ailments. So as a medical doctor, you're going to be seeing all these different a plethora of patients that have all these different ailments, you know. So I think that puts you light years ahead of your peers that work in a city that predominantly has a certain population. So that, I think that's going to be a big benefit to you as well. So some of our specialties, you know, this is a big list of them. I'm sure there's probably a couple more that I missed or didn't put on there. It doesn't mean that we don't offer it. It just means that I didn't put it on there. So anytime too, you guys have questions, just let me know. I'm gonna open up my chat as well. Let me move it to the side here. So this is a list of the residency locations we're at as well. Our residency, we have like a 1 to 2% that you will not have an Army residency, that it'll be a civilian residency. Usually that's on a case-by-case basis, and that's like if you have a medical, like say your parents or somebody is affected medically and you can't go to one of these places, the Army looks at that situation and says, okay, well, we can, you know, possibly put you closer to them or something. So there, you know, the Army does work with you on a lot of things. It's not as stringent as a lot of people think. Of course, everybody wants to go to Hawaii though as well, so some of them are a little harder than others to get to. So during residency, my boss kind of put this together. You know, you're gonna be a captain. You're gonna get your housing allowance. You're gonna get allowance for food, the subsistence, and then the extra pays here and there as well. So putting all that together, it's approximately $85,000 a year. Where he did his math, you know, for a California residency, and this is about a year or two ago, but it was 50 to 60,000 a year. So it's quite a big difference there as well. Your benefits of being in the military and being in the Army, you have 100% medical and dental coverage. You know, you're still young, so sometimes, you know, people need braces, stuff like that. The Army is going to pay for all that for you as well. You get your 30 days paid vacation. Right now, I think I'm probably at about 70, 80 days. We're allowed to have 60 at the end of the year. So I definitely need to take some time off. But my job is so enjoyable and easy that, you know, I keep working and I forget about taking leave. But it's there though, definitely. No cost moves. Of course, you know, in the Army, we do get to move. You know, like I said, I'm from Texas. My first duty location, well, I did training up in Oklahoma. I was in Missouri. Went to Germany, all over the German nation over there. Came back to Texas. I was in Washington for a while, and now I'm in California. So definitely moved quite a bit. They send a crew out to your house. They box everything up for you. They move it to the new location, and they send, you know, they send you the boxes. Here you go. They can even unbox for you, but I always prefer to kind of unbox myself. And no malfunction insurance. So malpractice insurance. So, being a new doctor, that's a huge cost that you guys incur. And the Army says, we got you, don't worry about it. So that's another thing that'll kind of help to offset your starting off fees. So all in all, that's kind of my spiel on things. There is my information there, and I definitely want to hear from you guys of what you guys think about the program, any questions that you might have. Are you having a good day today?
Feel free to use your mics if you have questions as well. You don't need to.
Yeah, definitely.
Write them out.
Yeah, so I've been in California 4 years now. My son, he's 17. I think he's 16. He'll be graduating next year as a senior. And we asked the Army, hey, we understand that they understand that my son will be graduating next year, and instead of having us move, because after 3 years of doing this job, they usually move us somewhere else. We asked for high school stabilization, and the Army said, yes, we will keep you here because we understand, how hard it is for a junior senior to move and start fresh, so we'll definitely leave you there. So that's another program, that the Army has to kind of help assist with the family life. If anybody wants to talk about my job in the military or doctors I've worked with or anything like that, feel free. They give me like an hour to talk to you guys today. Normally I get like 5 to 10 minutes. So, I kind of put me in a bind, like, okay, I got a whole hour to talk to you guys. What do I want to say? And I am a fast talker as well, so it always does kind of put things on me, like, all right, what there's only so much I can say about this program before I start talking to you guys and figuring out, what your backgrounds are and what you kind of need from me to kind of proceed with this.
And I have a question that we can throw in here is, how did, I think what some people might struggle with is like, how did you come to say, like, I'm going to go the military route versus not the military route for going to med school? Was it like anything more than just the financing? Like what was that sort of kicker that led you that way?
Yeah. So me actually, I didn't get to utilize this program. I didn't know about this program until I actually became a medical recruiter. I'm actually enlisted, so I'm not an officer and I'm not a doctor as well. I'm a medic. But talking with all, and I put this out to the students as well, talk to the different doctors out there, talk to everybody you can talk to about everything, to find out things, because that's the only way you're going to find out the truths. Sometimes we have doctors that come in and speak with us and for us, and they tell the truths to the students as well. And most of the doctors I talked to, they said, well, I didn't know about this program until I became a doctor. Then I found out about it, and I really wish I would have went that route. And we have other doctors that say, oh, I went that route and it was awesome. I didn't have any payback, any loans at the end. I got such a vast array of knowledge, doing this program, the leadership skills, everything that the Army throws in. It's just some people are for traveling. They definitely want to get out there and travel and do humanitarian missions. Again, that's something that the Army does a lot of. We go to the different nations and we give back. I was in Afghanistan for a year, and I would travel to the different clinics, and I would see that once a week they would open up to the civilian population. And man, that line would be around the whole area. It's like, it was huge. The civilians just couldn't wait to get in. And again, that's more knowledge for us, because we're treating third world problems that, again, we wouldn't see here in the United States. So it's definitely challenging and exciting. So.
Here's another question. Is there any kind of virtual shadowing program that is going on right now where the students might have access to speak with some military doctors?
If they get with me, definitely I can put them in touch with a few doctors that I know that are around in this area. And of course, they can ask any questions they want to ask, and figure out if they can do some kind of shadowing definitely. And again, that's going to help them to get a better understanding of the program, and that can also lead to a good letter of recommendation at the end of all that as well. So.
All righty,
Yes.
thank you for that.
Yeah, no problem.
Any other questions out there, guys?
Everybody's shy today. It's Saturday. It's early. It's early, I guess.
Cold and rainy.
Is it still raining? I haven't even opened the door yet.
I don't know if it's raining either. I haven't gone outside. I let my dogs out and they came back in.
Yeah. So yeah, definitely my information's there. So if you guys want to speak with me later, because you don't feel like speaking now, or if you want to email me your questions as well, it's all there for you as well. We do cover, we're out of Sacramento, but we cover all of Northern California, to include Nevada, Reno. We go quite a few places. I think it's like 88,000 square miles that we cover, our one team. And I think currently there's four of us. So we do some driving, and we do get to talk to a lot of people. If you haven't heard of us before, and if you're part of a club or something that that you would like us to speak at, we can do that as well. I can set up a short, a commercial type thing, where I give a minute or 2 minute speech, or we can do a longer class if you like as well. Before COVID, we were doing a lot of cool things. We were doing like suture classes. We'd go out and purchase a whole bunch of pig's feet, and we'd make incisions on them, and we'd say, okay, here's a class on how to suture. Let's see you do it. So that was really cool as well. It's hands-on. We give you a little lunch at the beginning of all this, and then you get to dive in. So it's a lot of things that we could do, and hopefully when we get back to normalcy again, we can start doing it again. So.
All righty. Well, thank you very much. We'll hang just for a second, see if there's any other final questions. Otherwise, thank you all for coming and participating in this particular panel. And we can finish up as soon as there's no more questions or there is any questions.
Thank you for your time.
Thank you for coming.
All right, sir.
Stop the recording here.